Good morning, everyone. I'm Megan Cullup, along here with Scott Michlin.
Good morning. Your camera is not good. Well, you're bright, and you're in a corner. So I'm gonna talk to you and adjust this real quick.
Okay, we didn't do my close-up.
Yeah, how's that
thing? It's better. I don't know, audience. What do you guys think? I just feel like everything's very bright. I feel like I'm being interrogated today.
Really?
It's us who ask the questions, not questions asked of us.
That's right.
Yeah.
Okay. Anyway, we're back.
All right.
Okay.
Okay. Here we are.
Thank you. Sorry about that.
Yeah. Although my head's a little cut off now.
Well, now it is, but now it's not.
Okay.
See?
Cool.
You're just bright.
I'll just slouch a bit.
Yeah.
How's that?
You're fine.
Okay.
You're fine. Anyway.
All right. Anyway, so it's week 59.
Yes, isn't it? Holy smoke. Oh, there it is. Right. Boom. There we go.
Ooh.
Look at that.
That's magical.
Right like that.
That's why we have visual radio.
That's right. Visual radio. That's what it's all about. So what a show we have today, everybody, right? We've got a lot of great guests coming up. In fact, I want to show everybody that Dr. Scrace is going to be on the show. Dr. David Scrace, he is the Cabinet Secretary for the Human Services Department, talking about the big changes that were announced yesterday by the governor and Dr. Scrace and Dr. Collins, the Department of Health Cabinet Secretary. So that's coming up in the next few minutes right here. Then we're going to have Jason Sandel on the program. He is a member of the Economic Recovery Council. Talk a bit about what these all mean for businesses in New Mexico and his work. And then two other guests coming up about contact tracing, which we've been talking about for 59 weeks on this program.
That's right. Yeah, and this is contact tracing done here at San Juan College.
Right.
To give some context.
Exactly. Yeah. But explaining...
You don't know what they do.
I don't know what they
excited to hear.
do, and this is done repeatedly at other businesses all across the world, and so we talk about contact tracing, but I don't know if we've ever really delved into what that's all about. So anyway, so that's what's coming up today, everyone. So we're glad that you are with us, and let's get started by talking a bit about the announcements yesterday at the press conference that was held by the governor, and basically it is that I'm going to take those off in just a moment here because it's blocking our graphic. The home stretch, the state had announced, right, that new criteria, the governor actually pushed this through faster than the rest of her advisors wanted, going into effect tomorrow, April 30th. Every county goes back to kind of green or turquoise, almost like kind of a reset on the color map.
Oh.
Right?
Okay.
We were yellow.
Right.
We're yellow today. We're green tomorrow.
Okay.
Okay?
Wow, a color reset on the map.
Right, and that's because some of the criteria is changing that's going to be used to develop the map, right, and to assign the colors and things along that line. So that was part of the deal. Dr. Scrace is going to explain this more in depth in just a minute with me, but they're adding the vaccination rate, that new gating criteria. And so that is kind of what they're planning to do. They're increasing the numbers of, remember the daily case rate per 100,000 used to be 8, now it's going to be 10.
Okay.
Right? And the other one was the positivity rate had to be less than 5, now it's going to be less than 7.5.
Okay.
So those are the major changes. And then how the counties go into turquoise, green, yellow, red are changing just a little bit. And once you get into turquoise, you can actually stay there. You kind of frozen there for as many as 4 weeks. You're not bouncing back and forth. And
Dr. Scrace is going to explain these in more detail.
Much better than I can. Much better.
Well, just in more detail, right? Because there's some.
So stay tuned. I know. Because you weren't here to talk to I talked to Dr. Scrace yesterday afternoon, and you missed being able to be here because of your other obligations.
That's right.
We understand.
Yeah.
But
it wasn't intentional.
No, of course not.
You didn't kick me out of the studio.
I did not, at least not for that reason. No, did not. And so again, the differences would be the current map is on the left, and then the revised map, which will go into effect tomorrow. And this is what happened, right? They took the current red, yellow, green, turquoise framework, and that's the map we have today. We're in yellow. And then they added the new framework, right? Those higher positivity rates and things like that, and the vaccination rates, and that makes it the new map, which you see now on the right-hand side.
Got it.
So as you can see, there's 10 additional counties in turquoise, there's 3 additional counties in green, and there's 12 less counties in yellow. And so, and one less county in red.
Yeah, like I was just going to say, shout out to Colfax, red to turquoise. Boom.
With the new criteria they go into.
Comeback kid right there.
There you go. So that's what we're talking about. So without any further ado, let's talk to Dr. Scrace. All right. Joining me this morning once again to talk a little bit about the state's answer to COVID-19 and some of the changing gating criteria that was announced at a press conference on just Wednesday. Dr. David Scrace is joining me this morning. Dr. Scrace, good morning. Always great to have you on the program. Thank you very much.
Good morning. Nice to be back.
You bet. As you said, long time no here, but we've been thinking about you, and I guess Wednesday's news was big enough to get you back on the show. So some big changes, I guess, in a nutshell, for the gating criteria and for many New Mexico counties, correct, if all goes well?
Yeah, that's exactly right. And, we suspected very early on from our preliminary data that the vaccination was going to be an incredibly important key component to our response to coronavirus. And it finally came along, and our early data showed that completely. And so now we're really at the point where we can take advantage of that vaccination effect, and we can actually, per suggestions from all over the state, including Farmington, build a vaccination metric into the gating criteria, not to disadvantage anybody. The way it's set up right at this point is it can only help move people into the green and turquoise colors.
Right, and that's kind of the plan. I know as of Friday, right, you said that most counties should be in either green or turquoise with this new criteria. The governor mentioned she kind of overruled some of her advisors to make that happen sooner than later.
Yeah, I was one of them, but in my defense, I just did what I was assigned, and I think she made the right decision because she took advantage of the fact that using the new system as applied a week ago actually would bring a lot more counties, 10 more counties into turquoise, an additional 3 more into green. And if you like, I can share this transformation and what exactly it looks like.
Yes, please. Go right ahead.
Give me a second and I will make it a little bit bigger for your viewers. But here we are with the report we released last week. There was a number of counties that were concerned, yours being one of them, of going back to yellow.
Right.
And when we added that vaccination metric, and we went back to last Wednesday, so we made it 35%, and then we also changed the test positivity rate from 5% or less to 7.5% or less. We upped the cases per 100,000 from 8 per day per 100,000 to 10. And then we applied this 33% vaccination rate. It moved so many counties. I mean, you just have to take a quick look to your left and then look to your right. This is the map as we'll have it online on Friday. And the key, and why I think the governor made her move, was that this locks these turquoise counties into turquoise for 4 weeks. And so it's a great advantage and gives those counties who might be a little behind on their vaccination rate time to really gear up and do more clinics and catch up, and while at the same time they're working on their other numbers. So we think this is going to be very positive for the state. We think it's going to be positive for businesses in the state, and we're just asking 2 things. 1, more people to get vaccinated, and 2, everyone to really adhere to those COVID-safe practices, particularly businesses. And please encourage your customers to adhere so we can stay safe and keep in this wonderful map color. And I think it's possible, or probable actually, if we control the spread of cases, we don't have an unexpected variant that's resistant to the vaccine, that this map will be looking all turquoise sometime in June.
Very good. Well, and you mentioned, Dr. Scrace, the other changes to the gating criteria. One of those is the number of positive cases per 100,000 and the test positivity rate. Can you just spend a moment and explain that to us too?
Yeah, sure. And I've got a visual if you want to use that.
Sure. Thank you.
Tomorrow, we had 2 metrics. Now we've got 3 by adding the vaccination rate. It says effective May 4th, and that was true because I went before the governor made her announcement that she was going to make it effective on Friday. And we've gone from 8 cases per 100,000 to 10. On a state level, that's 168 cases a day to 210 cases a day. We've gone from a less than or equal to 5% test positivity to less than or equal to 7.5%. We do have a vaccine target, and here's another bonus for the state. Our completed vaccination rate for the whole state is actually higher already than the target next week. Now, we do apply that on the county level, but just so everyone understands, we're at 41.6%, I saw today, and here we are with a target for next week at 40%. So,
and that's San Juan County's numbers you're talking about, the 41.5, I believe, right?
No, I didn't refer directly.
Oh, pardon me.
San Juan County, but I will show you something else in a minute.
Okay.
Where we can look at that together, because there was a very, very extensive effort to bring the federal data in and properly apply it to counties. Very easy to do with our state data, very hard to do, and I'll show you how that worked out in just a second. Our small county, we're giving credit to smaller counties so they're not flipping back and forth from colors every single 2-week period. And then the criteria really are the same. If you meet two criteria, you're in green. But last time it was 2 out of 2. This time it's 2 out of 3. Turquoise, you can get there right away. You can go from red to turquoise, for example, if you had all 3 criteria met. And then we're going to, as I mentioned, we're going to lock in for 4 weeks. Let me just show you and your listener viewers.
I believe I did look at the vaccine map, and I do believe we're doing better than that 40%, but you'll certainly tell me if I'm mistaken.
Yeah, no, I will. And what we did, it was a chore, as I was mentioning, and we had some great people at DOH.
Yes, because the numbers did jump over the last week. I did notice that, and that is the addition, as you're mentioning, of these federal vaccination numbers, correct? And so that would take in maybe reservation communities and some of the federal military installations and things like that would add to the vaccination counts.
That's exactly right, and because those vaccines are not evenly distributed across the state, for example, one of your neighbors went from one of the very lowest state vaccine rates to one of the highest in the state, if not the highest federal plus state vaccine rate. So this is a dashboard. We're all familiar with that.
That's McKinley County, yes.
41, yeah, McKinley County. Thank you. And so if you go down here and you really have good vision, and by that I mean better vision than me.
Dr. Scrace, we're not seeing your screen anymore, so I'll just.
Right, I will do that. I will do that. Let me share it.
Thank you, sir.
So there we go. So now I'm on the website.
Yep.
And you can see that we've listed the combined number of residents fully vaccinated, federal and state vaccines, and the percent of those eligible residents fully vaccinated. So if we go down to San Juan, we can see that you're at 50,000 and some change, 69 additional vaccines fully vaccinated, and eligible population 97,000. So here you are at 51.6%. So this is a nice one, because unlike the other 2 metrics, Santa Fe can bank on the fact that you are going to meet this metric next Wednesday, 2 weeks after that, when the target's 45, 2 weeks after that, which now we're into June, when the target is going to be 50. So that's kind of encouraging.
Yes. Very much so. We're ahead of the game, I guess, is what you're saying. And
at least in that one category. But now you've got a guaranteed one. And all you have to do, if you can get 3 or do 2 consecutive periods of green, which would actually kick in next week if you stay green on all 3 metrics, that will turn you to turquoise, and then you're locked into turquoise for the rest of the month of May. So lots of options here, lots more openings. But again, if we reopen things at the turquoise level and people abandon, getting tested when they have symptoms, if they abandon, wearing masks and COVID safe practices, it will slip back. So it's a sort of a deal between the state and the counties that we're going to do this. We're going to make it easier for you to get there, but you're still going to have to maintain those COVID safe practices to state.
Right. And thank you for explaining that. And that certainly makes a lot of sense and brings me to my next question a little bit about the vaccine rollout in our state, which the governor touted today, and for good reason, a leader nationwide in getting shots in the arms of New Mexicans. And that is why you can start talking about some of the other things that were mentioned on Wednesday's press conference of maybe even doing away with the color-coded map by the end of June, if all goes well.
And that's the idea. And, just on a personal note, I was reflecting, because I actually had a minute to reflect, which is a little unusual, right before the press conference. And I sent Tracy a note, because this is a big day for me. I mean, what is it, COVID day 414, I think? And we're actually talking about bringing this to an end. And I sent her a text. I said, despite the uncertainties, this is an incredibly exciting day for me. And I feel I owe it all to you and your vaccine strategy. And so all that credit goes to Tracy Collins, MD, Laura Perrone, MD, who really have guided this effort and wisely, I think, along with the help of the governor, prioritized our populations to our most vulnerable. And because they did that, when other states were just sort of opening the doors to everyone, that I believe, in my opinion anyway, is what's dropped the hospitalization rate and the death rate and the case rate as well. So it is really that vaccine effort. And it doesn't hurt that we're number one in the country getting people fully vaccinated.
Right. Well, and let me ask you about that, Dr. Scrace, in the minutes we have remaining this morning, because I know we're at 50% here in San Juan County, as you showed us, and the whole state is certainly closing in on that 40%, if not a little bit above. I think it's 41, right? Statewide.
41.6. Right.
Statewide. So what would you say to folks who maybe still have some of that vaccine hesitancy, because maybe getting to that first 40% was pretty easy. It's that next maybe 20% that's going to be more difficult to get us to 60 by the end of June.
And that is a true statement. And I want to caveat what I would say to people with the foreknowledge that there's good research now, even some that's been done in New Mexico, that state officials are not as highly valued as trusted messengers as one's doctor, one's community leaders, one's church leaders. And so I just want to make that clear that I think I have a few things I can say, but they'll mainly be, I'll be telling you what I would tell a patient of mine, because that's the relationship where I feel like I have the most influence. And when my patients ask me about, should I get the vaccine? I'm worried, it's still, it's just an early release, and should I wait a couple of years? What I've been telling my patients is, the potential negative effects of people in your age group, and in my practice, they're 75 and older, the effects of getting COVID and the risks of getting COVID are so very much higher than the risks of getting a vaccine. And what I would tell a patient of any age is, in addition, when you get this vaccine, you also protect older or more vulnerable family members in your household. And you now, as we're seeing, there are a few more things you can do, and everything you can do more safely. And so I would really encourage your listeners to talk to someone they trust. I mean, talk to their primary care practitioner if they have one. Like, what do you think in my particular situation? They'll have a much, much better take on what the best thing is to do than any state official, including myself.
Okay, fair enough. Very good. And last but certainly not least, Dr. Scrace, was mentioned on Wednesday's press conference that New Mexico may be leading the state when it comes to talking about herd immunity because of the success of the vaccine rollout here and things along that. Are other states really watching what you're doing and asking you about this?
Yeah, well, not yet. I think part of the problem is nobody knows what percent of the population one has to vaccinate to reach herd immunity, which is not the elimination of the virus, but it's a dramatic decrease in cases that allows us to do most of the things that we'd want to do. I mean, I think the evidence that we were predicting would come about in January has come out this week. It looks like people are planning boosters. It looks like there are variants that will ultimately be resistant for the vaccine, although we have not identified any clearly yet. And so we are probably settling into a routine. So we don't know what that magic number is. But there are two things we do know. Number one, when we vaccinated people in nursing homes, when we hit 65, 70% of people fully vaccinated, we saw a meteoric fall in cases, hospitalizations, and deaths. We vaccinated 70% of the teachers who registered, and there have been very few cases in the 23 days that schools have been fully reopened. We probably need a little more time to weigh in on that. So, plus, there's some herd immunity from the people who have had COVID and aren't getting the vaccine. And then remember that in general, the people who've gotten one shot run, I'm just looking at the website. Today, it's about 16% higher for the people who've just gotten their first shot than it is the people who are fully vaccinated. And so even if we get to June 30th and we hit 60%, we're 3 weeks away from 75% at that point.
Understood.
So what I said in the press conference is, because we have no one to look to, and because we're number one in full vaccination, it may be that we're the ones telling the rest of the country what number you have to get to in order to actually believe and have more certainty that we've reached a herd immunity state.
Understood. Well, the news was pretty exciting and positive. I could see the smiles on all of your faces on Wednesday when you appeared with the governor because of this outlook, and it does look positive, but I think the message remains: stay vigilant and stay using those safe practices, those COVID-safe practices we've been hearing about now for 400-plus days.
And I think the last thing is, if you have any hesitancy, please get vaccinated. But if I'm not your trusted authority, please talk to the person you most trust about your own health to get their opinion and decide together what's best for you and what's best for your family.
Great advice. Dr. David Scrace, we always appreciate your time. It's very valuable. Thank you very, very much.
Great to be here. Thank you so much, Scott.
Thank you. Take care.
Very good. So that was really helpful information.
Yeah, I thought so. Right?
Yeah.
Exciting news. I mean, that we're moving in the right direction, and the state is making plans to get rid of the map and some of the restrictions, many of the restrictions. So all that is good.
All of that is good. Well,
Yeah.
I think our next guest is on the phone.
I think she is. He's been waiting patiently to talk to us.
This is Jason Sandel from the Economic Recovery Council. Jason, thanks so much for joining us.
Good morning, Megan. How are you?
Good. How are you?
I'm doing very well, and good morning, Scott.
Good morning, Mr. Sandel. Great to have you on the program. Thank you. And you heard Dr. Scrace a little bit, and I imagine you probably watched the press conference yesterday. And so we wanted to ask you a bit about the work of the Economic Recovery Council as we talk about, moving in from some of these, changing some of the criteria and the gating criteria that Dr. Scrace explained. So can you give us some insights into that?
Certainly. We've been working as an Economic Recovery Council to advise to the medical advisory team and to the administration as a whole about just exactly what Dr. Scrace covered, how we can bring vaccination rates into the gating criteria so that then we can encourage people inside of the communities across the state to get vaccinated and then, drive that herd immunity that you spoke about.
Very good. So what does this, so let's just assume that everything goes swimmingly and next Wednesday we're in turquoise. Like, what does this mean for our businesses?
Well, it's huge, not only to get to turquoise, and as you guys remember, we've been to turquoise before, but then staying there. And that's one of the changes that the Economic Recovery Council had really spoken with the administration about, which was it's really difficult for a county to bounce back and forth. And so one of the major changes that really isn't getting a lot of focus is that once you get to turquoise, then you get to stay at turquoise for that 4-week period to prevent bouncing back and forth and having different capacities put into place. And so that's very important for our businesses. And so we'll be able to open and stay open longer is really what it comes down to.
That's good news. And, of course, all of this is under the auspices of the state saying that in 9 weeks, if the state can get to 60% vaccination rate, the whole color-coded map system goes away.
That's exactly right. And there are some changes that are coming for the distribution of the vaccine that I think will help us get as a state to that 60% number. And really taking into consideration that your personal health is truly personal. And so I think that you're going to see that there's going to be a push for primary care physicians to begin to be able to distribute the vaccine in their offices, and rather than having to go to a vaccination clinic. And we're hoping that will be a strong incentive for folks to be working with their own medical provider and boost those numbers from the 41.6 that we're at now up to that 60%.
That would be very good. And so let's talk about businesses early on had to put into place COVID-safe practices. We've all seen the signs. We've all had to comply. How long are those things going to persist? How long are the COVID-safe practices going to be in effect when we scrap the map? Are we scrapping those? And maybe that's something that we don't have an answer for right now, but...
Well, we did hear the governor answer a question yesterday about COVID-safe practices and the emergency health order just generally. And what she said was that the health order is going to stay in place for a variety of reasons, and also COVID-safe practices need to remain in place as well. And so, there are very basic things that we need to be doing to ensure that we've got, good, healthy communities. And that's really about personal responsibility, following through with the mask mandate and following what CDC is telling us around mask mandate, making sure that we are socially distancing, making sure that we are using disinfectant and good personal hygiene. I think those rules are going to be in place for some time. The Economic Recovery Council is going to be looking at the details of all of the COVID-safe practices to see if there are some that really aren't needed anymore. But at the end of the day, I think we're going to be following those pretty basic rules for some time.
That's good to know. And, of course, I wanted to ask you a bit, Jason, about maybe the other point of view. And you're a businessman here in San Juan County, and I'm sure you hear from a lot of other business owners, and we saw some of the comments yesterday during the press conference. Of course, there's always folks who would say, just open up our state and let businesses open 100%, and certainly there are reasons why that hasn't happened. But do you get some of that as well in your email inbox?
I certainly do. As you can imagine, Scott, I get a lot of feedback from people across the community who all the way from opening up high school sports to having zero restrictions around travel restrictions and those types of things. And what I try and do is bring those conversations to the Economic Recovery Council, and then hopefully have them communicated to the governor and to the medical advisory team. One example of that is really this notion of how we were turquoise and then slid back to yellow, and what an impact that was to our businesses. And so getting that feedback from the community, taking it to the Economic Recovery Council, and then seeing it actually change in what the governor announced yesterday is really the power of the community being able to speak through the Economic Recovery Council and to the governor.
Very good. Well, Jason and all of you guys at the Economic Recovery Council, thanks so much for your continued work as we press on in week 59. You guys have been pounding the pavement. We're so appreciative, and thank you so much for coming on to speak with us today.
Well, thank you for having me, Megan. And can I give a plug just real quickly?
Of course.
The mayor sent out an email last night, and he is spot on in what he's saying, that we've met the vaccination rate criteria. We're at 51.6% 6%. But our positivity rate continues to go up. So it's test positivity rate. A couple of weeks ago, we were at 4.93%. He's quoting that we're currently at 5.3%. And of course, if we go above that 7.5%, which is the revised positivity rate, then we won't have the opportunity to go to turquoise. And so making sure that we are still getting tested, and especially if you are healthy, getting those good, clean tests coming in. And so the mayor promoted that there's a testing event that's going on at McGee Park today, starting at 8 a.m. and going through 3 p.m. And so really encourage your listeners to go get a COVID test so that we can keep that positivity rate down, which then would throw us into turquoise and help us open businesses here in San Juan County.
Very good. Well, yes, thank you for that. And thanks again, Jason.
Hey, thank you, guys. It's great to talk to you as always.
And you too. Thank you very much. Jason Sandel from the New Mexico Economic Recovery Council, our guest this morning here on KSJE. We want to talk a bit about the watch list before we get to our next guest, because they are talking about contact tracing, and of course the watch list is all about contact tracing. So let me show the latest businesses on the watch list. This week, of course, it's updated daily from the New Mexico Environment Department, and so we can see on the watch list, the 11th Judicial District Court in Aztec has 2 rapid responses, Hillcorp in Aztec with 2, the District Attorney's Office in Farmington with 2, Farmington General Services with 2, the Farmington Police Department now has 2, Smith's Food and Drug has 3, the Walmart Supercenter on East Main with 2 rapid responses. Aztec High School has 3, Kugler Middle School in Aztec with 3, Lydia Rippey Elementary in Aztec with 2, Animas Elementary in Farmington with 2, and Mesa View Middle School with 2, and Piedra Vista High School in Farmington with 2 rapid responses as well. And so let me go to our guests, who is on the phone this morning, and I hung up on one of our guests.
Oh, no.
So I'm hoping that they will call us back, because I apologize for
this is
fat
why
fingers.
You don't even put me in charge of the phones.
I
because
don't.
That would happen all the time.
I don't, and I meant to just put them both on the air, and one went away, and now they're back. So sorry about that. So we have our both guests back on the phone. So let us go to that now to talk a little bit more about this contact tracing. So good morning. Thank you for calling into KSJE.
Good morning.
Good morning, Scott.
Good morning. And we have on the phone with us Jeanna Fresquez, who is the San Juan College Environment, Health, and Safety Coordinator, and Paulette Stanley, who is also part of the contact tracing team here at San Juan College. So again, welcome to both of you. And Jeanna, can we start with you maybe by talking a bit about your job as in regards to contact tracing here at the college?
Yes. Yeah. What we do is Paulette and I, along with Melissa, we do have a pandemic team that we work closely with the employees and students, vendors, contractors, anybody that actually comes to campus. In the event that they are near a confirmed or suspect case of COVID, we encourage everyone to contact our department in the pandemic. And so we actually do a general interview with the individual just to find out if they were actually positive on campus. And going forward with that, what we do is we actually have the area closed off. We'll put a ticket in and get it disinfected. So we definitely follow the guidelines of the New Mexico Department of Health and the higher education. So the guidelines in those senses, we make sure that if the person is a confirmed case, we definitely require them to quarantine.
That makes sense. So Paulette, let's go to you. So a student or an employee from San Juan College comes down with COVID. They call you guys' office. What exactly happens from there?
So what we do is we open a case report in our system, Maxient, and we go through a list of questions with them, such as have you been out of state? What are your symptoms? When did your symptoms start? basically we do this to determine return to campus date for them.
Gotcha. And so talk to me a little bit, I guess, Jeanna, Fresquez, back to you a little bit about the numbers of cases here at San Juan College. These are certainly, they're reported publicly, and it's my understanding the college hasn't had any, or if any, very low numbers of actual positives on campus. Anything would have been someone maybe who had contracted the virus elsewhere, who maybe came onto campus for some other purpose. Am I correct, or am I misremembering something?
Well, yeah, you are correct. Most cases actually come outside of campus. We did have 2 cases that were a contact-to-contact on campus, but they were just the 2. But otherwise, when we do our contact tracing, most of them either are contracted outside of campus or unknown, where they don't know possibly where they contracted it at. So most of the time it is off of campus.
Great. And so, Paulette, when you talk to these students or employees, I'm assuming it's a very simple interview, and then from there, again, like you guys said, they quarantine for 2 weeks, or what does that look like?
Well, right now it is 10 days with a 4 days being mindful is what the guidelines from the Department of New Mexico is stating. So we go from their first symptoms date, we take the 10 days and list that as their return to campus date. And then there's other cases that vary that Miss Jeanna could probably talk a little bit more about. When there's more positive cases within the family, it actually gets extended a little bit. It becomes a 10-day quarantine, and then once that family member finishes that, then they have to start their 10-day quarantine. So it's actually a 20-day quarantine when there's multiple family members who tested positive.
I see. Yeah. And Jeanna, we've had those same situations then since this all began, what Paulette is describing?
Yes, it is. It used to be a 14-day quarantine, and the state actually releases all update policies and requirements. So now it's moved to a 10-day quarantine, but if it's a family member that is living in the household, the quarantine then becomes more extended because of the fact that it's more so like a domino effect. One person gets it and then they're transferring it to the next family member because they're pretty much not quarantining or trying to be isolated, I should say. So it makes it hard for family members because a lot of times people don't have 3-story homes or a basement to actually go in and self-isolate in a certain room. So that's why they've extended the days for each member that has tested positive or has symptoms.
That makes sense. Well, Paulette and Jeanna, thank you so much for all that you guys are doing to keep San Juan College community safe, and thanks so much for coming on.
Well, thank you for having us.
Great. Thank you both very much. Very interesting. Again, as we talked about this for weeks now, right? And learning more about what that means.
Right.
And having to talk to people and track them down and see who they came into contact with, right? So all that contact tracing.
I know. It kind of demystifies the process for me.
Yes, it does, indeed. But a lot of work to do that with the numbers of cases that we have seen. And I want to go back and just kind of remind everybody about that before we wrap up the show today. But it's been a great show. We've had a lot of great information. So, again, we always thank all of our guests for being here with us. But Johns Hopkins keeps tracking the numbers, and here we are again, right?
Here we are. So United States confirmed cases are now at 32,232,267. United States confirmed deaths are now at 574,343. And
there you go. And you can see, we've heard a lot in the news about India, of course, the last few weeks, and you can see where they are at 18 million cases and change, just below the U.S. I think Brazil had been behind us with the numbers of cases, and now India has taken over that second spot in worldwide cases.
Right.
So there is that. And, of course, we kind of look at that. I kind of look at that little graph at the lower right-hand corner to kind of see how things are going, and things have kind of plateaued a little bit. They've now dropped even more since they were maybe a month or so ago, which is good. That means the numbers of daily cases are dropping, which is what everyone tells me that is important. to get this under control.
Right.
So that's an important thing. In New Mexico, again, yesterday we had 248 new cases reported. Total 197,218. Of that, San Juan County had 24. And again, the numbers of San Juan County new cases has been fairly high, and that's why folks are concerned. That's why Jason Sandel mentioned this testing event to get folks maybe to go out and test negative, and that would lower the positivity rate, obviously, if you have more negatives than positives. But our positive cases were 24 yesterday. 12 deaths in New Mexico. None of those were in San Juan County, but elsewhere in the state. And the state reported 73 new recoveries yesterday from COVID-19, which, of course, is exciting news.
An important number to keep in mind.
As well, indeed. On the news page, KSJE.com, of course, as we've mentioned this morning, the numbers from New Mexico. Let's talk about Navajo Nation. And, of course, everything that we've talked about, from the color-coded map to some of these other things, the restrictions in San Juan County, everything on the reservation is different. They're certainly a sovereign nation. They have their own levels of restrictions and things along that line, which we'll talk about in just a moment. But their cases yesterday were 15 additional cases on the reservation for a total of 30,485. No new deaths, which has been either zero or maybe one death last 10 days or so, which is great news for the Navajo Nation. And then if you look at the fourth story on our screen, the Navajo Nation is preparing to go to yellow status on Monday. And so I think that's notable because that means restrictions are coming down and loosening up on the Navajo Nation. Their yellow status is different than the New Mexico yellow status, and so there is some semantics involved there, but certainly it's a little bit different depending on where you are. So we just want to make sure everyone realizes that it's not all the same everywhere in the state. The Navajo Nation is certainly a sovereign nation in charge of their own destiny, and that's why their Department of Health has come out with this other criteria as they move into yellow status. So that's what's going on there. So just wanted to share that with everybody. And I think that is about all we had to talk about today.
That's right. That's
which
our
was
show.
A lot.
Which was there was quite a bit packed in there. So,
but I think the takeaway is
get vaccinated.
Get vaccinated. If you have concerns about it, talk to your doctor, as Dr. Scrace mentioned. They're the ones that can certainly, hopefully, give you information about your particular health conditions and what the risks are and for and against, all those different things as you make that important decision for you and your family.
Right.
But the state is hoping that we can get to 60% vaccinated status by end of June. And when that happens, the color codes goes away. A lot of the restrictions go away. The COVID-safe practices may continue. But again, if I can eat at a restaurant with 100% capacity, that'd be a nice thing.
Or go to somebody's graduation, maybe.
Right.
That's also, the push to get tested and get vaccinated. What are we going to do in May? It'd be nice. We had a lot of, we had drive-through graduation ceremonies last year, and I know that was a big letdown for folks who were graduating.
And what all the schools are saying is they're going to have an in-person graduation for their seniors, just a matter of how many audience members are going to be allowed to attend.
Right.
And so you may have no audience, and everyone watching it online, if we're red or yellow, maybe 2 or 3 audience members available per graduate if we're green, and maybe more than that if we're turquoise.
Right.
But again, end of June, then everything maybe goes away if we get to 60%. So that's the key, and that's what everyone is hoping for. So
do your part, San Juan County.
There you go. That's right. And as we've said, we're already above what the state is asking for at that 40%. So that's great news. But we don't want to fall behind that schedule as that number of vaccinated population percent increases by 5% every 2 weeks. We need to stay ahead of that to meet that one metric, and then hopefully the other 2 and stay in the turquoise for the next 9 weeks, which would be wonderful. So,
wonderful.
Until next week, everyone, we really appreciate you joining us, sharing this program. If it's good information and you got some good news out of it and good information, please share it in your social media circles. And we'll be back, of course, next Thursday, 9 a.m. on social media and live, of course, on KSJE Radio every Thursday at 5:06 p.m. But have a good week, everyone.